Dr. Wiid van Sanofi Genzyme kuier vanoggend by ons om oor onder andere tipe 2 inflammasie en allergie-siektes te gesels. So good morning and thank you for joining us in studio today.
Good morning. Thank you so much for having me.
Now, Dr. Kim, what is type 2 inflammation exactly?
So type 2 inflammation is essentially an overactive immune response to something like an allergen or a parasite. So in a normal immune response, a person's body will perceive that there's an allergen and sort of the immune response will deal with it and nothing will go awry. But in a type 2 immune response, the body has an overreaction to this allergen, and this can be caused by a number of factors. So there could be a genetic component or an environmental component, and we often see type 2 inflammation in families because it is hereditary.
And what are the risk factors associated with this immune function becoming overactive?
So the risk factors really do depend on the disease that is caused. So type 2 inflammation can cause a wide variety of what we call atopic diseases. So those are things like atopic dermatitis, which is a subset of eczema, or asthma, or chronic rhinosinusitis with nasal polyps, or something called eosinophilic esophagitis, which is essentially an inflammation of your esophagus. And another risk factor that I think is quite often overlooked is the effect on someone's mental health when they have these severe type 2 diseases, because there sometimes aren't immediate cures or immediate relief for these patients. So people start to develop anxiety and depression because of the disease.
What are the symptoms or signs of type 2 inflammation?
So again, symptoms and signs will depend on the specific disease and which tissue is actually being affected by the inflammation. So in something like atopic dermatitis, the signs and symptoms would really present on the skin. So you would see, the patients scratch quite a lot because they're very itchy, and that, causes lesions on the skin, which can then get infected. And in something like asthma, which is another atopic disease, patients will often be coughing and wheezing and have asthmatic attacks.
So this inflammation, I'm just curious, is it something that you can pick up like a virus, or is it genetic, or is it inside you?
It's quite often genetic, because essentially what happens is your body will perceive an antigen, and then your body makes these little proteins called cytokines. And those cytokines then overproduce in response to that allergen. So no, it's not something that you can pick up, and people have it in varying degrees. So some people will have type 2 inflammation in quite a low form, and then they get like chronic rhinosinusitis, which is not just seasonal allergies, but something a little bit more in depth. And then other people really do have it in a severe form, and that would be things like severe atopic dermatitis or asthma.
And is it difficult to go through with the diagnosis, or to kind of like to decide whether
to pinpoint?
Yes,
so
that's the word I'm looking for.
I think it is quite difficult, because often patients will come in and say, oh, we've got severe allergies, but that doesn't necessarily mean that it's type 2 inflammation. That could just be sort of seasonal allergies. So, for medical professionals, especially specialists like dermatologists and pulmonologists and allergologists, they are very adept at picking up whether there is a type 2 inflammatory issue rather than just a seasonal allergy.
So how common are type 2 inflammatory diseases, and which are the most common here in South Africa?
Well,
South Africa specifically.
If we think about something like atopic dermatitis, that affects roughly 10% of adults, and that number is even higher in the pediatric population. So we see, even more children suffer from these type 2 allergic diseases, whereas something like asthma affects roughly 6 to 10% of adult South Africans. But for me, what's quite interesting is that one patient can present with multiple type 2 disorders simultaneously. So roughly 35% of people who have asthma also have atopic dermatitis, and upwards of 50% of people with atopic dermatitis also have asthma. So, these people really, they're not living their best life.
And how do these diseases differ?
So again, it really is just how they present. So which tissue or which organ is getting inflamed, and then what side effects is that patient having. So patients won't even always have the exact same side effects. So someone with severe atopic dermatitis, some people, they all itch for atopic dermatitis, but some would have, very dry, flaky, cracked skin. Others would have what we call lichenification, where the skin starts to turn leathery, so that's for prolonged disease. So yeah, it really depends on the disease.
Someone was just asking, let me just get a name. Mariska says, what about ulcerative colitis and immune deficiency?
So immune deficiency is a separate issue to type 2 inflammation.
Okay.
And the other disease that she mentioned also is separate. But type 2 inflammation often goes along with these other immune dysregulations because it's really indicating that this person's immune system is overactive.
Okay.
What is the relationship between type 2 inflammation and allergic diseases?
So that's actually a great question to ask because I think quite often people clump everything together as allergies, but that's not necessarily the case. So an allergic response is really a response to a stimulus, which we call an antigen, that is not necessarily a specific response. So an allergic response is not necessarily specific. But something like type 2 inflammation really is highly specific, and there are very specific immune cells that are then involved. So with type 2 inflammation, it would be type 2 helper T cells. And then those produce specific proteins like interleukin 4 or interleukin 13. And that results in things like atopic diseases.
Let's talk about the impact of excessive type 2 inflammation on developing multiple allergic diseases.
Great. So excessive type 2 inflammation really is what it says it is. I think the world is getting quite a good understanding that any inflammation is actually not good for people. So if we look at cancers and all sorts of other diseases, we see that inflammation often triggers, disease prognosis and onset. But for type 2 inflammation, we have these inflamed tissues and this genetic component that all go together, and patients then can present with one or more of these type 2 inflammatory diseases at any point throughout their lives.
Is it like, treatment? How long can you have this? Is it like ongoing? I know like with psoriasis, psoriasis, what is it in English?
Psoriasis.
Psoriasis. I mean, that's like permanent.
Yes.
Is some of these like a permanent condition?
Unfortunately so. So for people who have been experiencing, so atopic dermatitis and psoriasis are quite similar because they're both skin diseases. But psoriasis is what we call sort of type 1 inflammation, whereas atopic dermatitis is type 2. And unfortunately, patients often suffer throughout their whole lives. And, there's not really a cure because it's your immune system that's dysregulated. So, there are products available for patients, but there's no cure.
The one thing we've spoken a lot about immune, your immune system in the last year, especially with COVID and everything. But, like immune boosters and all this stuff, what can you do to strengthen your immune?
So really, I mean, it's like a holistic approach. So, you must make sure that you're eating a proper balanced diet. I know, we hear this all the time. And I think in lockdown, that was particularly difficult. Well, for me anyways. But, eat a balanced diet. Don't just sit behind your computer all day. Actually get up, move around so that your body really is functioning like a proper machine. And, for some people, immune boosters are a good idea. But really speak to your doctor and try and figure out the fundamentals first.
That's a good answer. Ek gaan nou van die rekenaar af opstaan en Hendrik hom 'n bietjie stokke vat. Ek gaan nou waai.
Dr. Kim Wiid van Sanofi Genzyme kuier vanoggend by ons om onder andere dan nou oor tipe 2 inflammasie en allergie-siektes te gesels. So thanks again for joining us this morning. What can one do if they are struggling with symptom control for an allergic disease?
All right, so I think the most important thing for a patient to do is really keep accurate records and accurate documentation of how you're feeling, which days you perhaps are having an allergic flare. And, if you can then also figure out perhaps what's triggering your allergic flare, then you can really go to your doctor with a good amount of information, which will enable him or her to determine whether you have seasonal allergies or if you have something like type 2 inflammation. And, if you do then have something like type 2 inflammation or not just seasonal or episodic allergies, then your GP can treat you accordingly or even refer you to someone like a dermatologist, a pulmonologist, or an allergologist.
And are there currently any treatment options available for people suffering from an allergic disease?
Yes, so there are a variety of treatment options available. And I think what's quite important to note is that traditionally these treatment options have been like a one-shoe-fits-all type of approach, whereas now medicine and science is getting really smart. So we're really starting to be able to target specific diseases in an individualized approach for the patient. So the patient's disease and the severity of the disease will then determine which treatment to go with. And I like to think of it almost like a tree analogy. So if you think of your immune system like a tree, and you have, let's say, a frisbee stuck in one of the branches of your immune tree, you don't want to go and chop off the whole tree and block the entire immune system. You actually really just want to target the branch where the frisbee might be. And that's where modern medicine really is getting smart. We're learning how to target the exact branch rather than chopping down the tree.
Is there a platform where people can find more information regarding this matter?
Absolutely. So for people who are struggling with things like atopic dermatitis, there are Facebook groups available. So just go and Google or go look on Facebook. There are definitely groups available for people to discuss, and sometimes even top dermatologists and top allergy experts will pop in on these Facebook groups and try to provide some guidance for patients.
Someone's just saying Dr. Kim is brilliant. Ja.
Thank you.
Sy plesier sê, ons sal vir sê plesier. Jy sê plesier.
Ek sal baie dankie sê.
Jy sal baie dankie sê. So just one question, when you know it's getting serious, it sounds funny, but you've got a little irritation on your skin. Is there symptoms that you realize, okay, this thing is going next level?
Absolutely, but I think for patients who have been experiencing this throughout their lives, their version of serious is different to what your version or my version of serious would be. So people should also really start changing the narrative around what they're experiencing and not just always put it down to, oh, but it's just today. If you're seeing that your skin is inflamed and you're seeing lesions and you're itching a lot, go and see someone about it, because you never know what is going to become available to you or what options there are. And perhaps it's going to be something as simple as changing your moisturizer or something more complicated like getting an escalation in therapy.
Any other advice within this regard?
Wow. I think really just be in tune with yourself and be honest with your doctor. And again, keep accurate records and take photos and really make sure that you know what's going on with your body and with your allergies, and then to know if it's time to escalate.
Thank you so much for joining us this morning. And dit was dan Dr. Kim Wiid.